I want to talk to you a little bit about something that affects more people than we realize. It's a very personal thing with guys. It's the development of breast tissue in a man that's larger than what he desires. And it probably doesn't take much before it's larger than he desires. Usually happens in puberty when that you're a little bit overweight, kind of a chubby adolescent male, and then as they lose some of that weight and start to thin down and muscle up, and some of those steroids, natural steroids, are working in the body, hormones, then they start to develop some even more prominent breast tissue. It can be pretty remarkable. I've had some young gentlemen that were starters on their high school football team that had C to D cup breasts, so you can imagine the impact that has on them in their lives. So we see young men at that age, particularly late high school, early college, and then we'll see guys probably in their 30s, early 40s that have this. But it is an imbalance between estrogens and androgens in a man's body that causes this. Some medications can cause it. The use of marijuana can cause it. But a lot of those things are ruled out very early, and it's simply that imbalance. Men have breast tissue just like women have it. So if there's an imbalance and there's more estrogen around for whatever reason, then you're going to get gynecomastia. The treatment for gynecomastia varies across the board depending on how severe it is. Sometimes it's just going in around the areola, making a little semi-lunar incision, and directly taking out the breast bud that is prominent. Sometimes there's enough fatty tissue around that area that we'll actually do lipoplasty first, and that further helps to define the breast bud that we need to take out, and then go back up to the areola and do the rest of the procedure. Sometimes we do a breast reduction, a full-fledged breast reduction, depending on how bad the gynecomastia is. Yeah, I get asked the question of, once I do a gynecomastia operation, is the result a permanent result? And even though that hormone imbalance may continue to exist, which it usually doesn't, it usually is just a season of a person's life where it's in effect, the target tissue, which is that breast bud, is gone. So even if the hormonal imbalance did persist, the target tissue there is not present to respond to it. So the results are a permanent result. The level of satisfaction of this operation is extremely high. You can imagine these patients aren't comfortable taking off their shirts or even wearing shirts that are tight-fitting, and very, very sensitive about it. So it's a life changer for them. The recovery is fast. They wear a little sleeveless compression vest for about a month. No strenuous activity for about a week, but they're in the shower the first day, they drive the next day, they're walking, that kind of thing. So after the first week, we really liberalize their activity a great deal. So if you'd like to know more about the treatment of gynecomastia, which is very common for us, then give us a call at 205-408-9787. You'll talk to a real person that can answer your questions, and we'd love to see you in consultation here at Clinton Plastic Surgery. You can also check out our experience on clintonplasticsurgery.com.